Question 1. A patient with ICP has a BP of 190/60ths, heart rate 48, and irregular respirations. Priority interpretation? A. Hypovolemic shock. B. Cushing's triad. C. Autonomic dysreflexia. D. Sepsis. Question 2. What is the priority action in the rhythm shown below? A. Administer amiodarone. B. Check the patient's BPC given IV beta blocker. D. Prepare for defibrillation. Question 3. A patient with Parkinson's disease is prescribed carbidopa-levodopa. Which instruction is most important? A. Take with high-protein meals. B. Stop medication abruptly if dyskinesia occurs. C. Change position slowly. D. Take at bedtime only. Question 4. A patient has right-sided weakness and expressive aphasia. Which cerebral area is affected? A. Right frontal lobe. B. Left frontal lobe. C. Right temporal lobe. D. Left parietal lobe. Question 5. A patient is experiencing autonomic dysreflexia. What is the nurse's first action? A. Administer antihypertensive. B. Place patient in supine position. C. Sit patient upright. D. Insert urinary catheter. Question 6. Client with schizophrenia states, the TV is talking directly to me. This is an example of A. Illusion. B. Delusion of reference. C. Flight of ideas. D. Hallucination. Question 7. A patient with a spinal cord injury at T5 is at risk for which complication? A. Respiratory failure. B. Autonomic dysreflexia. C. Loss of speech. D. Seizures. Question 8. A patient with meningitis has a positive Koenig sign. What does this indicate? A. Muscle paralysis. B. Increased ICPC meningeal irritation. D. Cerebellar dysfunction. Question 9. Which lab value best indicates worsening renal function? A. Sodium 138. B. Potassium 5.8. C. Hemoglobin 12. D. Calcium 9.2. Question 10. A patient with acute kidney injury, AKI, is oliguric. Which output is concerning? A. 60 ml per hour. B. 45 ml per hour. Circa 30 ml per hour. D. 20 ml per hour. Question 11. Which medication should be questioned in a patient with chronic kidney disease? A. Acetaminophen. B. Insulin. C. Ibuprofen. D. Erythropoietin. Question 12. A patient on hemodialysis develops hypotension during treatment. What is the priority action? A. Increase dialysate flow. B. Stop dialysis. C. Administer fluid bolus. D. Lower the head of bed. Question 13. Which finding indicates fluid overload in renal failure? A. Dry mucous membranes. B. Weight loss. C. Crackles in lungs. D. Hypotension. Question 14. Which electrolyte imbalance is expected in end-stage renal disease? SATA, A. Hypokalemia, B. Hyperphosphatemia, C. Hypocalcemia, D. Hypercalcemia. Question 15. Which urine finding suggests glomerular disease? A. Clear urine. B. Ketones, C. Proteinuria, D. Bacteria. Question 16. A patient with HIV has a CD4 count of 180. What does this indicate? A. Mild infection. B. Normal immunity. C. AIDS diagnosis. D. Viral suppression. Question 17. Which patient is at highest risk for infection? A. Rheumatoid arthritis on NSAIDs. B. Lupus on prednisone. C. Asthma using inhalers. D. Diabetes on metformin. Question 18. Which symptom is expected in anaphylaxis? A. Bradycardia, B. Hypotension, C. Hypertension, D. Fever. Question 19. Priority medication for anaphylaxis? A. Diphenhydramine, B. Albuterol, C. Epinephrine, D. Steroids. Question 20. A patient with neutropenia should avoid which food? A. Pasteurized milk. B. Cooked vegetables. C. Fresh apple. D. Bottled water. Question 21. Which lab confirms an autoimmune disorder? A. Elevated WBC, B. Positive ANA, C. Low hemoglobin. D. High CRP. Question 22. A patient is experiencing hypotension, chest pain in the pulse below. What is the priority action for the nurse? A. Synchronized cardioversion. B. Administer CPR. C. Assess the patients versus D. Give IV epinephrine. Question 23. Which finding indicates hypoglycemia? A. Polyuria, B. Fruity breath. C. Diaphoresis, D. Kussmaul respirations. Question 24. A patient with DKA will have which ABG finding? A. Metabolic alkalosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Respiratory acidosis. Question 25. Priority treatment for DKA? A. Insulin drip. B. Potassium replacement. C. IV fluids. D. Sodium bicarbonate. Question 26. Which symptom suggests Addison's disease? A. Weight gain. B. Hypertension, C. Hyperglycemia, D. Hyperpigmentation. Question 27. A patient with SIADH will have which finding? A. Polyuria, B. Hypernatremia, C. Dilutional hyponatremia, D. Dehydration. Question 28. Which lab confirms hypothyroidism? A. Low TSH, high T4, B. High TSH, low T4, circa low TSH, high T4, D. Normal TSH. Question 29. Myxedema coma is characterized by A. Fever and tachycardia. B. Hypothermia and bradycardia. C. Hypertension. D. Hyperglycemia. Question 30. Autonomic dysreflexia is triggered most often by A. Hypotension. B. Pain above injury. C. Bladder distension. D. Infection. Question 31. A patient with increased ICP suddenly develops a dilated, non-reactive pupil. What is the priority concern? A. Stroke. B. Brain herniation. C. Seizure. D. Infection. Question 32. Which finding indicates early hypoxia in a patient with a head injury? A. Bradycardia. B. Restlessness. C. Cyanosis. D. Hypotension. Question 33. The nurse suspects a hemorrhagic stroke. Which symptom suggests hemorrhagic stroke? A. Slurred speech. B. Facial droop. C. Sudden severe headache. D. Weakness. Question 34. A patient with Parkinson's disease is at risk for which complication? A. Hypertension. B. Falls. C. Seizures. D. Hyperglycemia. Question 35. Which drug improves symptoms of myasthenia gravis? A. Dopamine. B. Neostigmine. C. Phenytoin. D. Diazepam. Question 36. Oliguria is defined as urine output of A. Less than 100 milliliters per day. B. Less than 30 ml per hour. C. Less than 50 milliliters per hour. D. Less than 500 milliliters per day. Question 37. A laboring client has the fetal HR shown. What is the nurse's first action? A. Increase oxytocin. B. Turn the client to the left side. C. Prepare for delivery. D. Check cervical dilation. Question 38. A positive Babinski sign in adults indicates A. Normal reflex. B. Upper motor neuron damage. C. Lower motor neuron damage. D. Cerebellar disease. Question 39. A patient with ACI is prescribed IV fluids. What finding indicates improvement? A. Increased BUN. B. Increased creatinine. C. Increased urine output. D. Edema. Question 40. A patient with chronic kidney disease has a potassium level of 6.4 MEq per liter. What is the nurse's priority concern? A. Muscle weakness. B. Cardiac dysrhythmias. C. Fatigue. D. Bone loss. Question 41. Which finding is expected in myasthenia gravis? A. Muscle rigidity. B. Improved strength with activity. C. Worsening weakness at end of day. D. Spastic paralysis. Question 42. Which urine finding indicates dehydration? A. Specific gravity 1.005. B. Pale yellow urine. C. Specific gravity 1.030. D. Clear urine. Question 43. Which symptom suggests uremia? A. Polyuria. B. Confusion. C. Bradycardia. D. Weight loss. Question 44. Which assessment is contraindicated in an arm with an AV fistula? A. Palpation. B. Auscultation. C. Blood pressure. D. Visual inspection. Question 45. A client taking lithium reports nausea and tremors. Which lab is most important? A. Potassium. B. Sodium. C. Lithium level. D. Hemoglobin. Question 46. A patient with SLE is most likely to experience which symptom? A. Hyperpigmentation. B. Butterfly-shaped facial rash. C. Weight gain. D. Bradycardia. Question 47. A patient has rheumatoid arthritis. Which assessment finding is expected? A. Asymmetrical joint pain. B. Symmetrical joint inflammation. C. Muscle weakness only. D. Joint pain without swelling. Question 48. A patient with diabetes insipidus, D, will most likely experience which symptom? A. Oliguria. B. Weight gain. C. Polyuria. D. Hyponatremia. Question 49. A client at 10 weeks gestation reports morning sickness. Which instruction should the nurse give first? A. Eat 3 large meals daily. B. Drink fluids with meals. C. Eat dry crackers before rising. D. Take an iron supplement on an empty stomach. Question 59. The therapeutic communication technique that encourages expression is A. Giving advice, B. False reassurance, C. Reflecting feelings, D. Close-ended questioning.